Thanks for sticking with us on this Sunday morning. Friends of actor Eric Dane launching a GoFundMe for his family after the Grey's Anatomy alum died on Thursday from a long battle with ALS. He was just 53 years old. As of this morning, the fundraiser has reached over $250,000. This comes just 1 week after the death of actor James Van Der Beek. Before passing away, he revealed that even with resources and insurance, his treatment costs led friends and family to start a GoFundMe for him. That has now raised $2.6 million. This is a striking reminder of the gap between coverage and reality and the financial strain cancer care, health care can place on everyday families. Here with us now are veteran healthcare journalist and host of the Give It To Me Straight Doc podcast, Anjalee Khemlani. Anjalee, good morning. Thank you so much for coming on.
Good morning. Thank you for having me.
Of course, since these two deaths, we've been talking about it in the newsroom. I've heard conversations between so many people. If celebrities and other patients with insurance and resources are still struggling to pay for cancer care, what hope does a regular American have without that financial safety net?
Yeah, notoriously, in this country, we do see a lot of what we call underinsured individuals. Over a quarter of Americans are underinsured, which means that they do not have enough coverage, or the financial burden after paying premiums and out-of-pocket costs is significant share of their income. We know that the costs of care, including for cancer care, are pretty high. If you take a look at the list prices, they range from about $500 to $25,000. So once you're hitting those, five-figure price tags, it really gets to a point where it's unsustainable as a cost figure for Americans. Even if you ask for a cash price, which is one way out of sort of that insurance bubble, sometimes it's not going to make that much of a difference. And then you add on the cost of infusion rooms and the like. It really is quite a bit of a gap, like you said. If you note, looking at the sort of coverage for Americans, most Americans do get about half of Americans do get coverage from employers, but that leaves the other half getting a sort of a mix of, say, from government payers, or they've got self-insured, or they've got self-pay. And so you're looking at those actors as well, high-profile individuals, well-resourced and still struggling, in part because some of them did fall under that underinsured category. They may not have had coverage, it may have expired, or it may not have covered everything. I like to say that you have to really take a look at what your insurance does cover and what you're going to be responsible for. People often just look at the premiums or the out-of-pocket costs, but it tends to go beyond that as well.
Well, I saw our team made a great graphic kind of laying out the prices. One I saw was $25,000 per dose for cancer treatment, $25,000. What part of treatment tends to be the most expensive? I'm not sure how most Americans can afford $25,000 for one dose.
And that honestly has come down. There are therapies for different rare diseases that go up to $2 million. And we've seen that kind of coverage in the past. So the part about it that's most expensive tends to be the therapies, especially when you're in an inpatient setting. So what that means is that you're inside the hospital and you're getting treatment inside, either staying in a bed or, within what they call the outpatient center, those infusion rooms like cancer care. That's where the bulk of the cost comes from the care side of things. And part of it comes from because they have to add on costs, all the needles that you're using, the various equipment that are being used, testing even, all of that adds up to the bill.
Let's talk about colorectal cancer, specifically because we know that's the disease that claimed the lives of James Van Der Beek and Chadwick Boseman a few years ago. And we see the numbers of people getting diagnosed with this type of cancer among adults under the age of 50. Screening guidelines were lowered to age 45. Early testing is now critical. Even as younger adults continue to face these increasing diagnoses, Anjalee, does insurance typically cover those screenings? What should people know before they get tested?
Yes. In fact, preventative screening is part of the ACA, and that's why insurance has to cover it. Unfortunately, most people bypass it. We do have about 60% of the population getting those screenings, but that doesn't include those that don't have the coverage and those that are skipping it. So while it should be at 100% because it's covered, people often don't know that most preventative screenings are covered by insurance, and it's free, zero out-of-pocket costs. And so that is key to helping, especially if you've seen, like you said, the incidence rate increasing for those under 50, up 2.9% for colorectal cancer in particular, which is just astonishing.
Let's talk about outside of cancer care. What percentage of Americans have meaningful coverage for serious illnesses? I'm thinking about Eric Dane and, of course, his ALS diagnosis and untimely death. What does that reveal about how vulnerable people are to these high medical bills, including these Hollywood stars?
Yeah, unfortunately, even though, just as you showed that graph, which had the half of Americans having employer-sponsored coverage, that leaves half of all Americans with such a variety. So what that coverage looks like tends to be piecemeal. You could have high deductible plans, which means that there will be lower premiums, but it may not cover a lot of things, and you're going to be on the hook for a lot of that cost. Meanwhile, they've also got, plans that may be for short-term catastrophic plans, as they're known. There's also plans that have various levels of coverage. So basically, the way you have to think about it is the higher the premium is, more coverage that you'll get. But of course, that's not sustainable for most people's wallets. I like to tell people that you have to also make sure that you look beyond just the deductible and out-of-pocket costs. You have to look at allowed costs as well as co-insurance. It's really important to note whether or not you'll be on the hook for any kind of inpatient visit, any kind of hospital stay, because that co-insurance is a percentage of what insurance will cover, and then the rest will be on you. And most people don't realize that. They just look at, what the maximum is that they'll have to pay.
Yeah, sad reality for so many Americans. Anjalee Khemlani, thank you so much for coming on and just breaking all of this down for us.
Of course. Thanks for having me.
Of course. Still ahead, breaking news at airports across the nation. Why TSA PreCheck is no longer happening, what you need to know before you travel. Plus, political editor and anchor of The Hill Sunday, Chris Stirewalt, joining me on Tuesday's State of the Union. This as the president balances affordability, a partial government shutdown, and the buildup of forces in the Middle East. We're taking a live look at Capitol Hill this Sunday morning. We will be right back.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.